Hi, it's me, Dr. Katie, and welcome to ODDDUCKSCIENCE. Y'all, it is so hot outside, which means body odors have elevated and people are irritated about two ingredients that are supposed to quelch those body odors. So let's talk about them. There are two ingredients, aluminum and fluoride. I'm gonna scoot up closer and let you all know that aluminum is not found in deodorant. Hear me again, aluminum is not found in deodorant. So stop telling people to use deodorant with aluminum because aluminum is an ingredient in antiperspirants. Deodorant works differently. It masks or neutralizes body odor that is caused by bacteria that is mixing with sweat, aka your own personal air conditioner. Now, there are ingredients that are in deodorant, but they're not aluminum again. They include things like baking soda, alcohol, and fragrances. Now, when we look at antiperspirants, they contain aluminum compounds, and they're considered an over-the-counter drug. That's why they have that nice old drug facts box on the back of your antiperspirant stick. Now, how these antiperspirants work is by simply dissolving your sweat and forming temporary plugs in the sweat ducts, which blocks the sweat from reaching the surface of the skin as well as dealing with odors. Now, according to toxicologists, about 0.07% of aluminum passes through the skin. So you may be saying, Dr. KT, that doesn't seem like a lot. So why would there be any concern about people using aluminum or going against using antiperspirants? Now, antiperspirants keep you from sweating, so you're not going to sweat. And also, they're applied near breast tissue. And aluminum has the ability to imitate the hormone estrogen, and estrogen has been known to promote the growth of some breast cancer cells. However, in 2014, a group of toxicologists reviewed the research and concluded that there was no clear evidence that these antiperspirants, these aluminum compounds, were raising breast cancer risk. And I want to point out there is a warning on the back of that drug fact box for antiperspirants. It states if you have kidney disease, don't use it because the function of the kidney is altered in that disease state and it's not able to filter out the aluminum like a healthy kidney would do. Now, let's talk about the second ingredient that's in personal hygiene products, and that is fluoride. Now, fluoride is in toothpaste, okay? Fluoride is generally safe when it's inside of toothpaste, but excessive uses of it can lead to irritation and dental fluorosis. And shout out to Jade for letting me know about this condition because I had no idea. Now, dental fluorosis occurs primarily in children under the age of 6 when excessive fluoride is ingested. Severe fluorosis can make the teeth even more brittle. And adults can also show signs of dental fluorosis if exposed to high amounts of fluoride levels over time. Think about the fluoride in your water along with it in the toothpaste. Now, swallowing large amounts of fluoride toothpaste can cause some GI issues. Think about nausea, vomiting, and excessive ingestion can cause skeletal fluorosis, again, making the bones very, very rigid. But the largest concern that people have is that fluoride tends to stay in your teeth and in your bones, and that accumulation at high levels has been linked or have been suggested may affect neurodevelopmental issues. And because of this, there's also a drug facts box on the back of your toothpaste. Now, some people have altered to get rid of fluoride altogether, and they use tea tree oil or coconut oil. Think about the trend where people are starting to use oil pulling to manage their teeth. Because again, fluoride is an over-the-counter drug because the purpose of fluoride is to prevent cavities. Now that we have all the facts, let's jump into the 3Ds. The first D, aluminum and fluoride are both naturally occurring minerals, and they are used in our everyday personal use or personal hygiene products. Too much of either one of them can cause some adverse reactions. So independently in small doses, they're okay. They're generally considered safe. Now, let's look at this second D, diversify. How does this affect me? How does this affect my community? Okay, so this is going to cause us to become more curious about what's in our products. And it should also make us consider, there are some people that are choosing to reduce their amount of exposure because it's something that they're dealing with personally. So that means we're going to be a lot kinder in this season when people are choosing to use different types of deodorant that aren't antiperspirants. So hopefully we'll give some grace in this season of hotness. Now the third D, how can I put my dazzle on it? We're going to talk about precautionary measures. So what that means is we're going to reduce exposures from some of those minerals, like aluminum. Aluminum comes from more places than just antiperspirants. Think about cosmetics like sunscreen, which is also over-the-counter drug, lipsticks, and think about how we wrap our food in aluminum. Too much can be toxic, so we want to be smarter consumers. And when it comes to using fluoride in toothpaste, y'all, you have to use a pea-sized amount. Oftentimes you see commercials, and I know I've been guilty of it, where you cover the entire toothbrush and sometimes you double back. That's wrong. That's too much fluoride on top of thinking about all the fluoride that is in your water. Okay, well, I hope you learned something today. And as always, science is accessible to everyone. Until next time, have a glorious day.